Hello, I'm Ashley Spice. I'm an Autism Ambassador. I'm neurodivergent myself and I work doing a couple of projects. Last year I helped set up a project called Room 1 in Portsmouth, which I no longer work for, but I'm really proud of setting it up and delivering long-term peer support groups for autistic adults in the Portsmouth area. I currently work for Autism Hampshire. I've been there for over 2 years and I absolutely love my job. I now work as the service manager for external training and specialist mentoring departments. So I run a great team of people for specialist mentoring who deliver sessions to university students who are autistic. And in the mentoring team, we deliver training services to parents, schools, and professionals to teach them all things neurodivergence and neurodiversity. And my positive story is that I've just learnt so much about myself, and I think in order to advocate for myself, learn more knowledge, I think I'm a better person to work in the field and be able to advise. And I'm really, really proud of what I've been up to, and it's great to be an ambassador.
In September, I started a new role as Parent Support Advisor, offering support and advice to parents who are finding their child's behavior challenging. Many of these children have a diagnosis of autism, are on the waiting list for an assessment or present with autistic traits. My role involves meeting with parents, to be someone who listens to their concerns and struggles, to deliver workshops so they feel more confident in understanding and managing behaviors, and to create action plans with suggested strategies for them to try at home. Most proud of the latter activity.
This year, I have helped to support an ASD member of staff who joined the Domestic Services Department for 3 months during the summer. I support his line manager to make contact with his family, to discuss his needs and how best to support him to succeed. We were able to create a daily routine for him to follow, which helped him to focus on his work and help the department achieve their targets. I hope this has provided this young man with some transferable skills that will help him with future employment, but also given the domestic services staff skills to support other staff members with ASD.
Hi, I'm Alex, and I'm one of the Autism Ambassadors for Hampshire. And I just wanted to give you a quick update on some of the work that I've been doing in 2023. I sit on an accessibility and inclusion panel at South Western Railway, and it's been great over the past year to be developing their services and working better to ensure that the needs of autistic passengers are met on their services. So just some of the highlights over the last year that I've worked with them on are the rollout of calm spaces across the network. These are limited at the moment because they are funded by the Department for Transport, but it was great to be on board helping by going to look at the locations of stations to check whether they would be suitable to have a calm space, and then working with the teams to develop the appropriate symbol to signify a calm space, and also some of the materials and equipment inside the calm spaces, taking into account sensory processing. So it's been great to work with them on that to ensure that autistic passengers are represented firsthand. And some of the other work over the past year that I've been working with SWR on is shadow journeys. So I've actually taken some of the senior management out on a shadow journey. So right from the beginning to the end, to highlight to them from a first-hand account again, how some of the challenges for people who are autistic and traveling on the SWR network. And I'm pleased to say that I even took the Chief Executive, Claire Mann herself, out on a shadow journey. And I know she found that really useful because she hasn't kind of had that first-hand experience, and she could see elements that maybe she hadn't thought of or her whole team hadn't thought of that could be changed quite simply to make it easier for autistic passengers. So that's some of the highlights over the past year. I'm looking forward to 2024 and helping South Western Railway develop their network to make it even better for autistic passengers, as I know they really do care about this. Thank you very much.
Operational Research Society, training to raise awareness, promoting Neurodiversity Celebration Week and writing about it. Slowly increasing understanding within the professional community. Bought all the Libby Scott books and the Professor Kirby book on neuroinclusion in schools and gave to a local primary school. plus shared Neurodiversity Celebration Week with them. They have actively engaged this year, training staff and plan to make in-school adjustments. Large piece in the school newsletter.
I have sourced and disseminated general online accessibility training for the organization, making sure that it contained lived experience throughout. This had a good section on autism. The feedback from our staff has been overwhelmingly positive. We have also supported our autistic staff who wanted to tell their story to their colleagues, which has helped them to feel more comfortable in the workplace. My team have created wow boxes of activities for children who get overstimulated in our workshops, and would normally leave the room. These have been successful in keeping the children involved in the session. These have resulted in many children with sensory sensitivity managing to stay in the room and participate.
I'm Kay. I've been an Autism Ambassador since 2016. I currently work for One Community, the Eastleigh Young Carers Project. One Community are a charity. We have several different community-based projects. All different types of things come under the One Community umbrella. Our Eastleigh Young Carers Project is just one of many projects underneath them. We run sessions for 8 to 18-year-olds who are in a caring role for someone within their family unit. It could be all kinds of different caring roles, physical health issues, disabilities, mental health issues, addiction problems, all kinds of different things. And what we have found is that we're in a unique group of people where we may have some young people who are caring for someone who is autistic, and we also may have some young people who are autistic caring for somebody else. So, and we provide the same opportunities to everyone, regardless of where they are on what spectrum or whatever. And we're very much one of my favourite sayings is that we're all different, therefore we are the same. It's one of my favourite sayings, and that's kind of how we run everything that we do. We work together as a tribe. We all know that we are different. We all need different things. We all like different things. We're all good at different things. We're all bad at different things. And together we're strong, because for some people who might struggle with one thing, we'll have someone else who can help with that. And that person might struggle with something else, and then the other person can help with that. And together we're quite strong. And when it comes to when we're discussing caring roles, for example, and we might actually be discussing, a young person might be saying the difficulties they're having caring for an autistic sibling, for example. We might have an autistic young carer who will say, I understand what's happening there, and can give their perspective of what's going on and offer different ways of potentially dealing with it. And then you also, on the flip side of that, you might have an autistic young carer who's struggling to comprehend the caring role they're in. And then you have another young carer who's able to explain all that. And it's just life, really. It's life. Everyone's the same. We're all coming together to try and help each other through what can be difficult times. So giving you specifics is really tricky because we just are.
I changed jobs and role in January. Prior to that, I was working in a school. I was continuing to support the school community, including colleagues, parents, and families and children, in making the environment as inclusive as possible. There was a particular focus on sensory needs. When I completed my previous ambassador training, I found the video of a shopping center and the sensory effect it had particularly powerful. Since then, I have tried to consider all areas from this point of view and looked at what could be implemented to lower sensory anxieties. I shared that video with colleagues.
Hi, my name's Melanie Wood and I am a sister in cardiac codependency at University Hospital Southampton. I also have a son with autism and ADHD. As an institution, the NHS has incorporated the Oliver McGowan training, which all staff are required to complete. This training aims to increase the awareness and understanding of NHS staff towards those with learning disabilities and autism. On a hospital level, we have a dedicated learning disabilities and autism liaison team with linked nurses throughout the hospital. They provide advice and support to staff, patients and families. On a ward level, I work within a cardiac codependency unit where I am the lead for autism, ADHD and learning disabilities. We offer cardiac, thoracic and vascular surgery and also cardiology services. As a unit, we aim to ask, listen and do in order to involve our patients and their families in their own care. We provide reasonable adjustments to patients whilst on our ward in an aim to accommodate individual needs and preferences. This is especially important for those with additional needs such as sensory, communication and a need for routine and pre-warning of things that will happen. We are dedicated to develop a triangle of care between our staff, patients and their families or carers with the aim to enable patients in their own care. I have a dedicated resource file that includes PECs, advice sheets, examples of hospital passports that people can use and develop. What I would like to develop in the future is better coordination between ourselves, patients and pre-assessment in order to plan visits to the unit before surgery and also to create social stories in order for patients to know what to expect before they come for surgery. And that's it. Thank you.
Working with the Faculty of Health and Social Sciences, I helped draft a roadmap for more inclusive practice. I created guidance on avoiding busy, noisy library spaces for the website and reading for well-being, stress relief, and delivered this at a well-being cafe talk to an audience that was largely neurodiverse. I co-authored a guidance document informing best practices in inclusive signage, space, and furniture design for the University Equality, Diversity and Inclusion Steering Group, and a committee responsible for steering environmental design.
I have highlighted autistic individuals and raised this to enable a diagnostic pathway to be followed. I have helped staff to support autistic students in their classrooms. I have supported students to feel positive about their diagnostic journey and learn about themselves and their needs. I have adapted my room to be low sensory and hence more accessible. I have provided a safe space during break and lunch for students who need it.
Hi, I'm Leah. I'm Sarah, and we are work coaches here at the Young Adults Employment Hub in Southampton Central Library. So the Youth Hub was set up 3 years ago, and we are a project that works closely with Southampton City Council and the Prince's Trust to support young people with all types of barriers moving into employment, education and training.
So we've been Autism Ambassadors for about 2 years now, and what we've managed to do in that time is we've delivered autism awareness training to our job centre colleagues. That was very well received. We were very proud of what we achieved there. We didn't do it on our own, there was a team of us. So we've also created an autism friendly youth hub here. So we have alternative spaces we can use to see people if they are uncomfortable in the main office. We also ask them very early on what they'd like us to do to adjust their appointments in any way. And we talk very openly about neurodiversity.
We also make sure that we're supporting the young people in whatever way they can do, and ask them if they can be as open and honest about how their neurodiversity affects them, not just in everyday life, but in particular potentially in the workplace, but also when they come in for their appointments with us as well. So we're very conscious of them being overwhelmed, too much information, too many demands being made of them. So just trying to keep things simple, breaking things down, and also backing up any agreements that we make with the young people about what they'd like to do to progress with emails and messages in their universal credit journals.
A bit about that is also giving a bit of time, thinking time. So we wouldn't demand of them that they make a decision straight away. We might ask them to come back next week once they've had a think about it. And it's all about what they want to do rather than what we're making them do, basically.
Yeah, we wouldn't mandate any young person to do anything, so that's really important to us. So behind us you can see our lovely positivity, and listed on the leaves here on the tree you can see lots of the roles that our young people here at the Youth Hub have been successful with, and that includes lots of our clients who have neurodiversities, and there's some really fantastic outcomes here. And if we can just move to this wall here, this amazing artwork was created by one of our young people that comes to see us, who is actually in employment now, but often will touch base with Sarah or myself for some additional support. So the support doesn't just drop off when young people move into employment. They can have up to 3 months in work support from us as well.
Something really important to mention, I don't think we've mentioned it, is that there's also, it's about talking to young people who think they might be neurodiverse, but they don't know where to start with that. And, we're able to reassure them and help them.
Make suggestions and just make them aware that going through an autism diagnosis is a long process, and it can take up to 3 years. We make suggestions about what they could do to make themselves feel more comfortable during that time. Chris Packham's done some amazing documentaries that are available on the iPlayer about autism. And just reiterating that even though it can feel very overwhelming and daunting to go through that diagnosis, that it might help them to understand themselves a bit better. And Sarah and I both have personal experience of people within our family units that are neurodivergent, so we do have some experience, but we also reiterate to the young people that we talk to that we know that everybody is different and that's okay.
We'd also just to finally say we'd like to thank our little director here, Trinity, who has filmed this for us today. She's one of our clients and she's also doing work experience for us at the Hub.
And one last thing. Sorry, Trinity. One last thing, we are very much about encouraging young people to be looking for, when they're looking at job applications and when we're offering that support for them as well, to be researching disability committed and disability confident employers and talking to them openly about reasonable adjustments in the workplace and that it's okay to be asking for those. So I think that just covers the support that we offer here at the Youth Hub. So thank you so much.
Thanks for listening.